Stuart, welcome to the podcast.
Thank you, Will. Appreciate it.
It's great to have you on. I know you've had a busy couple of weeks, so thanks for making the time. I say busy couple of weeks, sounds like you've had a busy few months. So thanks for taking the time. Do you mind just giving us a bit of an introduction to who you are, what you do, and what you're currently building at the moment?
Yeah, sure. No, thank you again for allowing me to be on the podcast. Yeah, so my background, I'm a urogynecologist and a reconstructive pelvic surgeon. I practiced for about 22 years in total. I spent time in both on the private practice side as well as the academic side. And then over the past 9 years, I spent in medtech. So I worked for a variety of very large medtech companies and really got interested in the startup world and what digital and AI is doing to healthcare and the positive impact it can have in healthcare. So I've made that transition from medtech now to a founder of a digital health startup company in my area, which is in urogynecology and urology, which obviously is an area I'm very passionate about, spending over 2 decades of my life treating these patients. So couldn't be more excited about the future of digital health, of chronic urology treatments through digital health, and what these tools are going to do to help patients.
Yeah, awesome. A big change, right? Going from what you're doing previously to what you're doing now.
Yeah, it's quite a big change. It's an exciting change. I feel like on the med tech side, I was spending so much time globally working on medical devices and impacting surgical procedures. But now I'm kind of back to what I absolutely love is patient care, is helping the patients one at a time with some of their issues that significantly affect their quality of life, affect their families, and to be able to help them. On a much grander scale than one patient at a time, which you typically do in a brick and mortar office, is really exciting.
Yeah, awesome. And I mean, this probably answers, well, that's a good lead into the next question. So what most lights you up about working in the industry, what you've done for the last couple of decades? Like, what is it that really lights you up and keeps you going with it?
Yeah, when I look back, spending my first 15 years was in direct patient care. And every day I would see patients, I would operate or take care of patients in the office or the hospital. And it was taking care of one patient at a time. And what really got me to shift into industry was scale, was impact. I could have a much bigger impact and an impact on a global scale by shifting into industry, and loved that part of my career, the almost 10 years I spent in industry. And now with these AI digital tools and the ability to impact more than one patient at a time, that's really kind of drawn me back into direct patient care, utilizing these digital health solutions, these digital health tools, which are truly amazing. They're going to really revolutionize care in so many ways and going to really help propel the treatments that we offer, customized treatments, really offer personalized care in a way that we've never really been able to do that before.
When you look out there at the landscape at these technologies, what kind of things are getting you excited, or who are you seeing out there that's doing it really well, other than yourself?
Yeah, no, it's a great question. We all hear about AI, but AI is really transformational. It's really going to change how we practice, how we treat patients. The ability to compile huge amounts of information in a way that a physician can never do. We try to read as much as we can, stay abreast of the evidence as much as we possibly are able to. But at the end of the day, there's too much evidence out there, that there's too much change that's occurring. And to be able to leverage these AI digital tools to enable us to provide better care is really exciting. And it's truly the future of medicine. It's never going to replace doctors, but it's going to augment our ability and our efficiency to take care of patients in a much better way than we ever had in the past.
Yeah, no, that word there, like augmenting how we do it. God, do you mind elaborating a bit more on how you see that happening?
Yeah, sure. I mean, having access at the touch of a button to the latest medical information and be able to apply that in real time to a patient care, especially when patients have unusual conditions or it may not be what you see on a day-to-day basis, is really groundbreaking. I mean, in the past, you would have a very complex a patient condition, you would maybe research it, look it up, spend hours trying to figure out what was going on. And now, with the touch of a button and using these LLM models, you can pull all the latest information and come up with a treatment program specifically for that patient. And, so much of the care that we provide is becoming protocol driven. But what I think the next step is really personalized protocol driven care. And that's not thinking of every patient as the same. If they have this one condition, we treat them all the same. But now with these digital health technologies and compiling all this data, we're really going to better understand that these particular patients who have maybe been treated in the past with these treatments maybe respond better to a different treatment, and we'll get these insights, these associations that we've never seen before through AI, and so that is so exciting. And I think it's really going to transform. It's going to take medicine to a whole nother level in the next 10 to 15 years.
Yeah, it's really incredible. I was speaking to somebody the other day, theirs is a genomics platform. They're talking about the way that we're able to access information within
Yeah.
minutes of wherever in the world this is getting collected from. We'll have it there within minutes to influence how we're now going to approach this next case. It feels like this real sense of a global collective consciousness around these kind of problems that helps influence that care. It's quite incredible.
Yeah, it really is. In the past in medicine, we would spend years conducting studies on very select populations to better understand what treatments would work. But now with big data, we're able to use what we call real world evidence, evidence almost in real time, and take huge populations, which were not possible in clinical studies, and really start to understand what works and what doesn't for individualized patients. So it's a really exciting time in medicine.
Yeah, so the speed of the care, the personalized care, but also like how quickly these new technologies and new treatments and things that come
Yeah,
into the market is quite incredible.
it really is. It's exciting.
So for you with what you're doing at Urology Health, talk us through a little bit more about the problem that you're aiming to solve.
Yeah, so in the United States, there and really across the world, but we when we look at the data in the United States right now, the chronic urologic conditions that impact patients the most are overactive bladder and urinary incontinence. And if you compile the data, the prevalence, and look at the population that it's impacting over 100 million patients in the United States, which is an enormous volume of patients. And the US healthcare system does not have enough specialists to manage that volume of patients. In fact, the volume of patients is only increasing as the population ages. And we know that these symptoms and these conditions are directly related to age as well. So with an aging population, your prevalence of this condition are going to increase over time. So we have to find better solutions, better ways to manage these patients when you have a very select group of specialists. And just in urology, a typical example is we have over a 40% shortage of urologists in the United States. And if you look at my field in urogynecology, there was a study that came out recently, which to me was astounding, that over 98% of zip codes in the United States do not have a urogynecologist. There's only a few thousand of us in the whole country. And so not enough specialists to manage the volume of these patients. In addition, these patients are waiting months to be seen by a specialist. And because the specialists are so overwhelmed and they're managing surgical patients and acute patients in the ER, and they just don't have the time to really sit down and spend a lot of time with the more of the chronic patients that have these chronic conditions, and really talk to them and explain their condition, and really have a better understanding of how it's impacting their day-to-day life. And so we need to be better about how we do that. We need to create efficiencies in the healthcare system. We need to ensure that the specialists are taking care of the high acuity patients, where these lower acuity patients, the chronic patients, that do need a lot of engagement, and we need to ensure that we provide that engagement to them. We need to also treat them in a lower cost setting with the ability to take care of them in much more real time than waiting months to be seen by a provider. So we have to be smarter about the healthcare system. We have to create efficiencies. We have to help the specialists who are completely overwhelmed right now. And that's really why we launched Urology Health. It's how can we take care of this very large group of patients, these chronic urology patients, in a lower cost, lower acuity setting, but offering them really almost in real time information through digital health, but also allowing increased engagement and accessibility to the healthcare system in a way that the traditional brick and mortar healthcare system is not designed to provide to those patients.
And walk us through like how do you do that?
Yes, so we leverage AI, we leverage digital health tools, and through a digital telehealth solution, we can see patients when they need to be seen. So if they're sitting in their living room or it's nighttime and they have symptoms, they need to talk to somebody, we can provide care in a way that a brick and mortar physician's office could not. In the past, you would have to make an appointment. It could be months out. We can provide that care. We can provide the counseling, the coaching, and really we can provide guideline driven care in a way that has never been provided before. If you look at the guidelines that are out there for treatment of these conditions, first line therapy, and this is universal really across the globe, is what we call conservative or behavioral based therapy. Unfortunately, it's very hard to achieve in a clinical practice where insurance doesn't pay for it, and the healthcare system is not set up to deliver that type of care. But we can do that in a much lower cost way through telehealth, and we could provide access to a multi-specialty team to these patients so they get guideline-driven care, they get first-line therapy, which again is very difficult to achieve in a brick and mortar physician's office, but in the comfort of their living room. And at a time frame that best suits them to learn, understand, practice the techniques that we'll be teaching them.
Yeah, awesome. Excited for it?
Oh, very excited. Very excited. It's something I've always thought of, kind of dreamed
Okay.
about when I was in clinical practice, having spent 2 decades taking care of patients. And this is universal amongst most of us in the field is we need to do better. We need to offer our patients more access and engagement. And we just have not been able to do it because the current healthcare system is not designed for this. So it's an idea I've had for over a decade, and it is
Okay.
so
Wow.
exciting to be able to launch this and work on this from the ground up and then bring this to patient care. I couldn't be more excited.
How nice. The sounds really exciting. The fact that you've had it for 10 years and have then now got really stuck into it, it must have been something that was beavering away in the back of your mind for a long time.
Yeah, and it comes out of a frustration. The
Okay.
patients are frustrated. The providers are frustrated. And so it's the frustration in not being able to provide the care that these patients need that that uh, that is expected of us to provide, and it's and we need to rethink the way that healthcare is structured, and so I really think telehealth is that tool that's going to enable us to rethink healthcare and create a better healthcare system in the future than what we currently have. We have a great healthcare system. Unfortunately, it's not efficient. It's very costly. There's a lot of changes that need to be done, but we have incredible providers. We have an unbelievable amount of knowledge. We just have to figure out the delivery side of it now. We have to be more efficient in the delivery, and we have to provide patients more access and different ways to engage than what has historically been done in the past. The healthcare system is just way too costly, way too bloated, and this is a way to help implement those changes for everyone.
Yeah, it's certainly going to shake things up over the next couple of years with things leaning down,
Yeah.
with new technologies. It's really going to, it does feel like it's going to look considerably different over the coming years. For you, what do you see as being some of the biggest changes that will happen over the next, I know, 5, 10 years in terms of how care is provided, access to care, etc.
Well, hopefully, depending on a lot of changes in Washington D.C. and political changes, but hopefully the needle will move again towards access to engagement to allow patients to be much more involved in the decision making, to allow patients to be engaged in how they get care delivered to them. And so telehealth is really going to lead this change, but we have to have the backers in the political world to enable us to help lead that change. And it's a back and forth, and we're continually making progress towards more of a telehealth world. I mean, if you look at what's happened in the last 5 years, it's absolutely remarkable that before COVID, pre-COVID, telehealth was present, but it really wasn't widely accepted, especially in the specialty world. But since COVID, we've really realized, and in urology, there's some great literature that shows that we're really understanding that for chronic urologic care, it can be very effectively delivered through telehealth, and you don't have to engage with the traditional brick and mortar to get that care delivered. There are certainly instances and times where you have to go into a physician, you have to have testing, you may have to have surgery. That's never going to change. And so telehealth, at the same time as it's changing the paradigm of care delivery, we also have to be careful about how we do it. We have to work within the healthcare system to deliver patients that need high acuity care to the right providers in the healthcare system. So it's not that telehealth is going to necessarily compete with the healthcare system. It really shouldn't.
Mm.
It should augment the healthcare system and act as another way of delivery of healthcare, but certainly in a hybrid approach, meaning when those patients are identified to have a condition that needs further workup, especially if they need testing or they need some type of procedure or there's an acute event, we have to partner with the healthcare system on the telehealth side to deliver that patient to get the right care at the right time. So it has to be done. Telehealth can't grow without the coordination of also working with the healthcare system. Healthcare, I've always said, is a team sport. We have to think of it as a team sport. We're all on the same team. We all want the same outcomes. We want to help patients. We want them to improve, get better, have better quality of life. We can only do it if we all work together as one team. And so the traditional healthcare system, kind of this newer healthcare paradigm of telehealth, all have to work in coordination to make this reality possible for patients. But patients will benefit, we'll all benefit from this transition.
Yeah, and are we seeing, or what are we seeing in terms of the results from these new technologies, this kind of the telehealth model, in terms of like the outcomes for patients?
Yeah, I mean, there's a lot of really interesting telehealth companies out there, and they have a lot of great data that shows that engagement is higher, patient satisfaction is higher, they're more compliant with their treatment plans or
Nice.
medication use. There's less use of ER and urgent care centers, and I predict that data is just going to continue to increase over time. When you're able, when a patient has a problem, if normally they would have to wait some days to sometimes weeks to see a provider, they're much more likely to seek out care through an urgent care and ER. But if you can treat them within 24 hours, or at least speak to them, understand the problem, and then offer some type of treatment, even if they still wind up seeing the provider in a few weeks, you really help them in the immediate term and allow them to get through to the time that they need their appointment. But if you can, through telehealth, if you can solve the problem, that's even better. But we need to reduce costs in the healthcare system, unnecessary use of urgent cares and ERs, because that's how we're going to drive costs down and make it a more affordable system for everyone. And at the end of the day, we all benefit from this. We get better care, better outcomes, better quality of life for our patients, and that's why we went into medicine. That's what we want. We want to help our patients.
Yeah, nice, nice. I'm gonna pivot the question slightly. What's been the most surprising thing thing for you now as a founder of now driving this idea into existence, if you like?
Yeah, that's a great question. What I found, this digital health ecosystem, how passionate it is, how advanced it's becoming, and the collaboration in that ecosystem is truly tremendous. I'm so
Interesting.
privileged to spend so much time every day and certainly weekly talking to founders of other digital health companies, and we're all trying to solve the same problem. We're all working towards the same goal. And it's so refreshing to get on calls, whether they're in a completely different area of digital health or even a very similar area. And we're all in this together. We all want each of us to be successful, because at the end of the day, it's about a patient. It's about that patient's family, and we're patients. Our families are patients. We all want improvement in the healthcare system. So it's really an unbelievable ecosystem, and we're really trying to solve some very big challenges. But the collaboration, to me, the passion that everyone has, the willingness to work together to make a positive change, is just so great to see in this digital health ecosystem.
That's the power of a shared vision, right?
It really is. And it is. I think it's the power of technology too. In the past, when we didn't have this technology, where we didn't get on a Zoom or a Teams or a Google call and just have these conversations, we would see each other maybe once or twice a year at meetings, and we're kind of working a lot independently. But now, these digital technologies are bringing us all together, and we're constantly talking and sharing ideas and trying to come up with newer solutions, and I think it's really elevated the collaboration that's out there. I'm in Miami, and I just been amazed at how many digital health meetings there are. There's breakfast meetings of digital health founders. There's nighttime meetings where we have speakers, and there's incredible ecosystem that's occurring in digital health and developing in so many cities, and not only in this country but really throughout the world. And that's the other part of digital health that I've been really amazed at is it's not just in the US where we're really trying to solve this problem, but I'm constantly speaking with companies in Europe and South America and really all over the world that have the same vision for their healthcare systems. And we're all collectively on a global basis sharing these ideas to improve patient outcomes. And that is really refreshing.
You've talked a lot about the collaboration within the ecosystem itself, other digital health companies. What other collaboration needs to happen in the broader ecosystem in order to sort of help create this change?
Yeah, and it's really a partnership between technology and digital health. And it's having those partners on the technology side that understand big data, AI models, and then can bring kind of the latest and greatest to digital health. So, and then it's a collaboration with payers. It's a collaboration with providers. We all have to come together to solve these problems. We have huge problems in the current healthcare system, and I think we all agree with that. I mean, it's far from perfect, but it is so great to see everyone starting to come together and coalesce around how can we create you or use technology to create new solutions, and especially in the digital world. And then how do we leverage that data to improve patient outcomes in a much quicker way than the traditional way we did it, which was randomized controlled trials or prospective trials or whatever type of trials we did that would take years and would study a very small population. Now we can study very broad populations and start to develop insights that we can never get with traditional clinical studies. I spending almost a decade in med tech, I witnessed this transition from traditional clinical studies to real world evidence. And so that med tech is in that transition right now, but real world evidence is going to completely change how medical devices are studied and approved. And we're even farther ahead in the digital health side of things, but we can only continue that transition by partnering with big tech and helping us on that journey. So it's really a partnership. It's again a team sport. It's all about us coming together, every part of the ecosystem, providers, payers, the patients, and the technology companies come together to improve outcomes. So it's a really fun. It's been a fun ride so far.
I love how it always comes back to that. Like, how does this
Yeah,
improve outcomes? How does this improve patient outcomes? I've said it before on the
yeah,
podcast, and I'll say again, like almost all the leaders I speak to, it comes back to how is this going to um, impact the patient, regardless of med tech, biotech, wherever in the ecosystem, wherever in that space people sit. For you, for your own skills and for your own yeah, but personal development, professional growth. Like, what have you learned about yourself going into this position as a founder and driving this?
yeah. That's a great question. It's really sparked even more passion towards what I do. It's exciting. I went into medicine to help patients. I wanted to have an impact. when I was in practice, I impacted, again, like we talked about, one patient at a time, one family at a time. When I did a surgery, it was focused on that patient, improving outcomes for that patient. When I saw a patient in the clinic, it was the same thing. And I made this transition towards med tech so I can have a broader impact and an impact really on a global scale, which was so exciting. And I had such a great career in the med tech industry. Now I'm kind of circling back to direct patient care, but in a way that I can now impact not just one patient at a time, but dozens, hundreds, thousands in a typical day at a scale I can never do before. But it's utilizing that technology to be able to do that. Again, this kind of new ecosystem, this new development of how we conduct medicine is going to be really exciting.
How are you seeing this impact on the kind of skills that are required from the talent within the industry as well? So obviously it's a
Yeah.
fast moving, fast developing area. So what does that mean for the kind of people that are entering the space?
Well,
Or not even just those entering the space, sorry, but those in it now and experiencing it.
yeah. You know, and we've been through this transition in medicine. We have to adopt to changing technology and new tools. It's interesting. So I went through the transition to EHRs back in the late 90s, early 2000s. That was a really tough transition. In fact, so tough that we saw so many physicians retire because they did not want to deal with this new technology. And unfortunately, it created so many inefficiencies in the system. It was supposed to improve efficiency and actually set us back in terms of efficiency. I used to come home at night and spend hours every night going through my charts. I mean, I was supposed to be done if I had handwritten notes, I was done at the end of the day.
Yeah.
And then with EHR, it just created so much more work, so much more confusion. I had to constantly ask for help to be able to figure out how to navigate through the EHR. And I think what's happening now with AI and these kind of new digital models, LLM models, is the ability to actually create the efficiency that we should have had 20 years ago. But we have to adapt to that. And if you're not willing to adapt to new technologies, new way of thinking, if you're stuck in how you were trained in your residency program and not willing to evolve, you're going to have a difficult time. So we need practitioners, clinicians in the space that understand technology is there to help, but we have to live with technology, and technology is not going away. So we need to figure out ways that we can work with technology. We can all work with the IT infrastructure and our healthcare systems, with the EHR companies to improve that patient care. But then we have to be open to utilizing technology to treat patients in a different way, such as remote patient monitoring, something I certainly was never trained in when I was a resident. But we have to become more accepting of this. We have to keep patients out of the hospital, keep them, continue to lower the costs, but provide better and better care for them at the same time. And the only way to do that is use this incredible technology, from watches to rings to all these smart devices at home that can monitor their patient, provide real time feedback. How are we going to manage all that data? So we have to, again, we all have to partner. We have to be accepting that this is going to become a big part of how we treat patients. And so we have to start working within that, what the future is going to look like for patients, and accept that future and embrace that future, and
Mm.
then utilize that, all that data to continue to make improvements at a faster scale than we've ever done in the past. And that's the other exciting part about this technology, is we can make improvements at a far more rapid pace than we had done in the past, which again, at the end of the day, it's good for patients and good for everyone.
Yeah, so there's a mindset shift there. For it's not the barriers
Yeah.
aren't just the tech, for example. They're also how is that adopted and how well do people receive
Yeah.
it and utilize it, etc. Any ways that you see that those changes are done more effectively, more efficiently? Is it training people on the benefits? Is it just going to be a necessary change because of how quickly it's going to move? And if you don't adopt it, you fall behind. Like, what's your take on that?
Yeah, I think it's manifold. It goes back to um, in medical school. It's so interesting. So in medical school nowadays, we're getting better, but we never learned the business of medicine, and that was a big deal for many years. And then now it's about technology and how to utilize technology and using EHRs. And so I think it has to go into our medical schools or medical training, that we have to embrace this technology and really better understand the technology to help our patients. And I think bringing clinicians into the ecosystem that have a tech background is equally as effective. Both, technologists that can come in and help us, but also as clinicians and those that really have a better understanding of how this ecosystem works and who can help us navigate through all these changes. And then embrace these startup companies and work with these startup companies, help them that are trying to make really positive change for patients. So, embrace this change, work within this ecosystem, try to get out there and partner or do research for a lot of these up and coming tech companies to help them achieve their goals. And so it's that collaboration that is going to be very much needed.
Awesome. It sounds like an exciting time. So what for you are you most excited about for urology health over the next like couple of years?
For me, it's so exciting to take an idea that I've had for well over a decade that I've always kind of dreamed of when I was treating patients and to create this concept from the ground up to bring it into, viability and then watch how it works with patients with the healthcare, the current healthcare system to improve patient outcomes. But to me, at the end of the day, it's so exciting to have that data because we want to drive better patient care and to have access to data that in the past may have been very difficult to achieve. Now we have access to data almost in real time and to use that data for the greater good to help patients to start to really figure out what works for certain patients and what doesn't work for certain patients and collect that data and then partner with clinicians, academic institutions to publish that data and make real change. That to me is so exciting. And so the future urology health, I couldn't be more excited about. And really to help these patients and really learn what works, what doesn't work, and continue to modify and grow the platform to customize it the best we can to help our patients is quite exciting.
You sound excited. I can see it on your face as you talk through. Sure. Thanks
Thank
so
you.
much for taking the time. Is there anything else that you would want to leave with the audience? Any advice, any insights, and just anything that you think they would find really valuable?
Yeah, and I think we talked about it within this ecosystem. It's really all of us to stay curious, to stay passionate about what our end goal at the end of the day, and that's to help people. And so I would encourage anyone listening to this to keep pushing forward, keep using technology to innovate. We always want to continue to make improvements. We want healthcare to get better. We need to create a more efficient system. But as we do this, we have to remember it is a team sport that we all have to work together. We all have the same common goal. And by us working collectively together, the power of the system is going to take us so much farther than if we don't work collaboratively. So stay passionate, stay, focused on innovation and work together as a team to improve healthcare. That's what's so exciting about this digital health world.
What a great way to finish. Thank you very much for taking the time. Really appreciate it. I'm excited for you and for what you're building. Definitely given the passion that you speak with, I'm sure you'll have plenty of people lining up to support you on that mission as well.
Well, great. Will, thank you so much for allowing me the time. I really appreciate it.
Absolute pleasure.